Welcome to foreplay.org, a nonprofit based service oriented company. Goal is healthcare. Healthcare, how we can improve the healthcare. I have talked several topics on impaired health plans, impaired health groups, impaired physically, economically. I see people on the street, they are mentally deranged and they can't take care of themselves. We have, as a society, we have a responsibility towards those folks. I'm talking about today Medicaid insurance card. I don't want this. Okay, if I'm unemployed, if I have no job, if I have no salary, they give me unemployment, whatever the insurance, whatever that is. But what I'm talking about, Medicaid, when I'm in a low income bracket, I don't have any funds in the bank. I understand, this low income bracket people, they don't have any bank account, they don't have any savings. I see a good opportunity for federal and state government to give them the tools what these people need. Yes, especially when it comes to healthcare. And these groups, economically impaired, physically impaired group, needs tools. They're not begging, folks. They need not, but give them the tools, give them the choice. They should have the same choice like everybody else, folks. They should have the same choice. What I'm suggesting is, if every one of you are listening, federal and state can do a better job than giving that stupid Medicaid card, man. I don't like it. Medicaid card, nobody wants to take care of you. Nobody wants to, because the reason I'm saying that, being a urologist, a robotic surgeon, I have taken care of a lot of Medicaid patients. This billing system, man, got to stop. This billing system is all messed up. We don't need a healthcare billing. That needs to be gone. Providers don't want to provide the care. Providers don't want to provide the care to the Medicaid, because I have treated about 30, 40 and billed the Medicaid. I get rejected and send me a check for 1 cent, folks, 1 cent. How do you make you feel as a provider? I said, do I really need to be bothered with this? I'm spending money for my biller. I'm spending and sending these bills to these agencies, and they deny it, and they pay you 1 cent. It's not like, I don't understand the rationale. If you are giving the card, at least you should pay the providers. So instead of that, what I have come up with a good solution, folks. That money where they're being spent on these bureaucrats, so-called middlemen. I see Molina, I see Scan. These people are minting money from Medicaid. These insurers, so-called insurers, are minting money from the dollars federal and state governments are spending on this indigent. Somebody is making money, man, in the middle. So what I want this nightmare to end is where they should invest in you. They should give you a Medicare insurance card. You allot certain portion of the budget, certain portion of the funds, whatever those funds are. If it's $500 a month, whatever, $400 a month, have you choose your insurance card and give them an incentive to save. If I choose a deductible policy, insurance policy, low premium, high premium, depending on my capacity, I will choose the card and save the money. Like anybody else, folks, Medicaid savings also. It's not a bad idea, folks. Medicaid savings. You should have a debit card, like instead of Medicaid, have a debit card. You pay as you go. You pay as you go. If you are seeing any provider of your choice, you are going to a facility of your choice, you should be able to go into any hospital, any facility, have the testing done. So you are like a customer. You're treated like a client, with respect. So you are making the payments. Once the people see the Medicare insurance card and Medicare savings, they understand you're coming from providers understand very well. Their payments are limited, and I'm sure once they are taken care of, you pay as you go. There's no billing involved. There's no billing. No billing has to be taken away, folks. Even for these hospitals, Medicaid charges, whatever it is, they cannot rip people with Medicare insurance card, folks. They need to be reasonable for people. Like EMTALA. EMTALA is when an uninsured person goes to the hospital, ER, they are mandated. Right now, what is happening is hospitals are losing money because there are so many uninsured. Talking about these uninsured, there are 27 million uninsured. That number is, with Obamacare, the numbers have gone down. I understand that, but I think it has gone down. You're talking about 2 to 3% of the population. You mean to say when the country is spending $3.8 trillion, they can't take care of the 2 to 3% of the indigent population? That's ridiculous. There's got to be a better way to handle the healthcare. Folks, I'm trying to simplify. I'm not, thanks to, I should commend, I've read a book, Unlocking the Secrets of Healthcare Premiums. It's an amazing book. You all guys should read it. Everybody should read it. I think it has opened my eyes. I really believe healthcare can be improved. America will be number one if you give a choice to you folks. My passion is, irrespective of where you stand economically, you deserve, as an American, you have a choice. Give them the incentive to save. I'm not asking for a handout. Give them the incentive to save money. Have your Medicaid savings card. That is yours to keep. You can pay as you go. If everyone is listening, if you like this conversation, we can keep on talking about it. I will continue to make this conversation. This is my lifetime passion, folks. No matter what happens to me, this is what I want to achieve, is consumer-driven healthcare, personalized healthcare for everyone, irrespective of where you stand. Subscribe and share and make some comments and touch that like button, okay? All right. Thank you, folks. Thank you very much for listening. I love you guys. I'll see you in the next episode. Goodbye.